healthcare, lawmakers are focusing on two competing bills. Let's take a look. The Alexander Murray bill keeps protections for pre-existing conditions while giving states flexibility to waive some coverage requirements. It lets insurers develop health plans and allows people to buy catastrophic plans with basic coverage. Now, the Graham-Cassidy bill leaves many Obamacare taxes in place and lets state waive some regulations related to pre-existing conditions. It also repeals the Medicaid expansion as well as federal premium and cost-sharing subsidies. It keeps dependent coverage for kids up to the age of 26. Andy Slavitt is former acting administrator of the Centers for Medicare and Medicaid Services, and Robert Moffit, I should say. I know him by Bob, as a senior fellow at the Heritage Foundation Center for Health Policy Studies. Andy, you did a lot of tweeting yesterday, and I thought it was very interesting. You seem to like the Alexander Murray bill. Is that right?
Well, what I like is anything that has both parties putting their fingerprints on something, and recognizing that Republicans would prefer to see this as a short-term path to repeal. Democrats would like to see this as ways to make the ACA work better. What the American public wants to see is the benefit of something like this that has an immediate impact on their premiums, reduces their premiums, and reduces the federal deficit. And I think, importantly, it could be a first step in a long, long slog of back and forth over the last 7, if not 10 years of parties essentially saying this is going to be winner take all. So I'm hopeful.
So, Bob, earlier in the week, President Trump initially signaled that he would be supportive of the bipartisan effort, and then he pulled it back sort of later in the day. And there are conservatives who are concerned about it. Even though it's a short-term fix, is this something that you would not be able to support?
I don't think that we would support something like this right now. The bill is basically a baby step in terms of regulatory reform. If you look at what's wrong with the individual market and the small group market, the health care costs are horrendous, especially for people in the middle class who do not get any kind of subsidies at all. The Alexander Murray bill does not go far enough in terms of regulatory reform. And frankly, the cost-sharing subsidies are kind of beside the point in a way. A lot of the low-income folks who would benefit from this will benefit anyway as a result of federal subsidies. But my view is that, no, it does not go far enough. What Congress has to do is it has to attack the fundamental underlying problem that we have, which is health care costs, and health care costs are being driven up by this excessive regulatory regime in Washington.
Well, and earlier this week, Andy, President Trump said that he believes that they actually now do have the votes. It wasn't clear exactly what bill he was talking about, but it's possibly Graham-Cassidy, and yet the Republican Congress was unable to pass that. So what happens, in your experience, if nothing happens between now and then? What will happen to people's premiums and the whole system?
Well, if Alexander and Murray's bill passes, I think we'll see a 20% reduction in premiums for the middle class. And I think we should keep it as simple as that. I know that think tanks both on the left and the right have an idealized view of what the world looks like. But when we govern well, we govern with compromise. If we don't do that, I think we will end up where we're essentially saying we don't like the ACA, so let's just keep shooting at it and shooting at it so it gets worse and worse and worse for people. I don't think that's how people expect them to govern. And I think we can take up in the new year long-term reforms of whatever type. There's no question that there's elements of every law that need to be working better. But right now, we have a chance to depoliticize things for a moment, get everybody on board with something that's actually good for people, and it's very hard to argue. Doctors, hospitals, patient groups, the Chamber of Commerce, everybody has said, let's go with Alexander Murray's bill.
Bob, when the Republicans failed to pass that legislation at the very real frustration of President Trump after, of course, being told that it was going to happen.
Right.
So now you actually have Obamacare more popular than it was even a year ago. So what kind of messaging do you think conservatives need to put forward to tell people actually it would be okay if we dismantle it and if we try to do something from whole cloth?
No, I think the fact is what conservatives ought to do is be very straight with the American people. We are not going to get health care costs under control if we retain the same system that we have today. And a minor regulatory change like Alexander Murray is proposing is far inferior to what we need to do. If you're a person who is in the health insurance exchanges or you're in the individual market, this year you've seen 25% increases nationwide in your health insurance premiums, looking at maybe 18% next year. And you've seen deductibles simply skyrocket. They're explosive, horrendous health care costs.
Yeah.
And it's hurting individuals and also people in small businesses who are being hit with these horrendous costs. The problem is many of the regulatory, much of the regulation is actually driving these costs. The age rating alone drives up health care costs for young people by about 33%. So no, they've got to stick to it. They've got to get the job done. And if they can't get it done now, they've got to come back in January, and they've really got to be serious about it and make that case.
Well, we'll see if the bipartisan effort moves forward or if the conservatives decide to figure out a way to do this as they have done on tax reform. You're both amazing. Thank you so much, Andy Slavitt and Bob Moffit. Appreciate it so much.